As the number of COVID infections continue to rise, local officials are floundering about for a way to limit the spread. On Wednesday evening, County Executive Mark Elrich announced that he is seeking the approval of the County Council for additional restrictions to further restrict indoor dining and severely limit the capacity requirements at retail operations and religious gatherings. These restrictions are set to go into effect 10 days before Christmas and in the middle of the Jewish Hanukkah celebration. Mark, it is clear that the government officials don't have a clue how to contain the spread of the virus. What is going to work?
Well, let's be clear. What Montgomery County is proposing is contrary to what the CDC or the quote science is recommending. What CDC is recommending is 6 feet separation. 6 feet separation requires 36 square feet, arguably 50 square feet if you extended an extra foot. What Montgomery County is envisioning is a far more rigorous standards. For retail, it's up to 200 square feet, and the standard for religious institutions, which really is something completely contrary to what the Supreme Court has said, limits them even further, where it is entirely possible to do the appropriate social distancing. Montgomery County's government completely ignores that.
Laurie, shutting down the restaurants will have a devastating impact on the business. I mean, 100,000 restaurants across the country have already gone out of business. But it's more importantly, locally, it will throw thousands of waiters, cooks, and kitchen help out of work at Christmas time. There doesn't seem to be a problem eating indoors.
Yeah, what a Christmas present to all of the people who work in our restaurants. It's just, you know, Dr. Travis Scales is a medical doctor. He's not a scientist. Why are our elected officials listening only to him? He keeps citing Dr. Fauci, but he construes what Dr. Fauci is saying. It's just not using science to determine this. Why are we going from 50%, which is what our state is doing, capacity in restaurants? We've already gone to 25%, which is half of what the rest of the state is doing. And now now the county executive is proposing that we have no indoor dining in our restaurants. How is this? This is taking something that's not working because our cases are still increasing. Where is the data? Where's the data that shows this? The CDC doesn't have information about saying we should be closing our restaurants indoors. The University of Maryland medical system on their website says it is safe to eat indoors if you follow precautions. So this should not be happening in our county. It's hurting our businesses, and it's just crazy. I don't understand it.
Sam, the restaurants I've been to in the past several months seem sparsely attended. There doesn't seem to be a whole lot of people actually going to restaurants in the areas that I've been to. But now Council Member Hans Reimer is suggesting that if we may need further restrictions, including a stay-at-home order. Now, these tactics were tried in the past. They were tried last spring. The pandemic is still with us. Why is it going to work this time?
Well, we have to remember that each jurisdiction is unique and has its own set of issues. For example, Montgomery County has more of a senior population than most jurisdictions do. Therefore, we're more vulnerable. And we have tried shutting down before. And if you look at California, 2/3 of the state is under lockdown, as are other jurisdictions. We're not proposing a lockdown. What we're proposing to do is a stay-at-home order to keep people at home and safe and reducing the curve. In this past week, we've had more infections in this county than we've ever had in the past, and we really, really have to get a handle on this. We're talking about the safety, the health, and the lives of citizens in this county.
And we may have more infections than we've had in the past, but the hospitalization rate for COVID patients still is half of what it was in May of this year. I think that the public is being misled by misleading statistics because the number of infections doesn't tell us the story about the dangers of the disease.
But what it does show you is as the infections rate rises, then your hospitalizations increase. And what Hans is proposing is to break that curve, lower the curve, so that we don't get to capacity in our hospitals. And that's very, very important. Look, this is a very, very dangerous time. All of the people that I'm talking to are really very, very scared of this, Casey. It is serious, and we have to.
What frustrates me, Sam, I think frustrates others, is that we are not giving any credence to the intelligence of the American people to make their own decisions. Do you think that there is not a single person in America that doesn't know about the need to social distance and to wear a mask and to use good sanitary measures in their lives? This is preposterous.
Casey, I would just like to interject here. There are 12 Republican governors who do not mandate masks because they say it's questionable whether they're useful. So this is a country, and people go across borders. We did flatten the curve in Montgomery County, but then people come from elsewhere. And the governor is announcing new restrictions at 3 o'clock today, Wednesday, and county executive also broke in Prince George's announced this morning. They're doing the same thing Montgomery County has, and when they had their big summit yesterday of the large jurisdictions, I believe they're all going to be on the same path. It is a
Susan, but let's address the fact you're not.
Everyone safe.
Sam, I want to hear from Mark.
I was going to say, what you're not addressing is that you're not following the recommendations of the CDC. Now, I get the fact that there's all this angst about it, but there are specific public health recommendations about the required distancing, and by quadrupling what that standard is, you're not making people healthy.
Well, Mark, their new research just came out yesterday from South Korea, and they have discovered that 5 minutes with the person 6 feet away can give you the virus. And they're saying it's probably more like 9 feet or more now. So other countries that are doing more tracing are finding that you have to go even farther. So I commend the executive. And remember, we can all do carry out and we can eat outside, so we can help save our restaurants. And there are some who say that to go back to school, we're going to have to close everything else down.
We're not really. It's a facade. We say we're going to save our restaurants, but the fact is they're closing. They can't stay in business. I talked to the owner of Potomac Pizza the other day. He has 8 outlets. If this is going further, all 8 of them are going to go out of business.
And
this isn't a joke.
It would
they
really
can't survive on carry out alone.
It would be really great if Congress passed the Relief Act so that we could get funds to these businesses so they could stay awake and alive until the COVID crisis eases.
Your answer is always somebody else's money to pay for it. Why don't we trust the American people to do what they're capable of doing, which is using their good common sense about whether or not they want to go to a restaurant, and not mandate some hypothetical standard that can't be verified.
They are verifying it, but you keep saying I don't want to hear statistics.
And they are driving people to sickness. So by closing these restaurants down, it keeps people safe. Nobody wants to close these restaurants down. I certainly
But we don't know that. We don't know that for sure that that's what it does.
I'm not sure that's true, though.
Well, we got a wrap-up question for Susan before we go on to our next topic about the school system, which is, if there are further restrictions like Councilmember Reamer is proposing, are people going to obey it? Are they going to
I would hope so. In Sweden, they kept the schools open because they had closed down everything else. And as Sweden said, we tend to follow rules. If we don't follow rules, it's going to get worse. All you have to do is look at a map of the United States. It's bright red. Yes, we're starting to get vaccines next week, but we're getting far less than what was originally quoted by the administration. So we've got a ways to go.
And
people want their own liberty. They want to be able to make their own decisions, and not
this will help
division superimposed on them by government.
Now that's the rule of government, to protect the citizens.
Yeah, right.